Cardiac rehabilitation is an integral part in the treatment of heart patients and is recommended by the European Society of Cardiology, the American Heart Society, and the American College of Cardiology. The Cardiovascular Rehabilitation Center at Terme Krka offers a program of cardiac rehabilitation following the most recent guidelines. The Terme Krka Spa is located 169 meters above sea level in the midst of forests and meadows. It has peaceful surroundings, a mild climate, and a thermal spring rich in carbon dioxide, magnesium, calcium, and potassium, with a water temperature of 32 degrees Celsius. The rehabilitation program is intended for patients with ischemic heart disease, especially patients recovering from myocardial infarction, percutaneous coronary intervention, coronary bypass, and cardiovascular surgeries. Cardiovascular rehabilitation is also suitable for patients with stable angina pectoris, patients with peripheral arterial occlusive disease, as well as those with a high risk of developing cardiovascular illnesses, for example, diabetics and patients with a metabolic syndrome. The aim of the rehabilitation is to restore patients to an active life without major restraints. After registering on the arrival at the spa, the patient is escorted to their room, or if they need all-day supervision by a doctor or a medical team, they are escorted to the nursing care ward. A medical cardiac rehabilitation program is led by a team of the following professionals: internists, a cardiologist, a physiatrist, a psychologist, a medical technician, a physiotherapist, and a nutritionist. Before rehabilitation, every patient is first examined by a cardiologist. At this first examination, the doctor learns about the patient's anamnesis, details of the illness, risk factors, and the patient's current condition. Next, an ergometric evaluation on the cycle ergometer is performed in order to assess the patient's physical ability. If further cardiac diagnostics is needed, an ultrasound of the heart and veins is performed. A 24-hour dynamic EKG monitoring or a 24-hour monitoring of blood pressure and laboratory tests. The rehabilitation program is tailored to each individual patient and is based on an exact evaluation of the patient's current condition, results of the initial ergometric evaluation, risk assessment, character and personal goals, and physical ability. The basic element of the rehabilitation program is physical exercise in order to improve cardiopulmonary functions, build and strengthen muscles, and improve general physical and psychosocial health. Patients do exercises for building muscles and improving their overall physical health. The training program is tailored to patients' personal needs and is held at a modern gym. In this way, the patient's physical condition and strength improve well enough to return to their everyday life and work. A hydrogymnastics workout is held at the thermal pool. Daily exercise on the ergocycle is prescribed for each individual patient and is performed with a telemetric control to follow the patient's vital parameters. Nordic walking, which considerably improves the patient's physical ability, is held in the beautiful natural environment of the spa. During rehabilitation, brush and hypobaric therapy are also performed. Rehabilitation also includes lectures and workshops run by a specialist doctor, a nutritionist, and a psychologist, enabling the patient to learn about their illness and the risk factors which may increase the danger of relapse. The lectures given by a nutritionist and the individually tailored diet are essential for the patient to learn about the importance of changing their diet. The menu in the rehabilitation program is based on a Mediterranean diet. At workshops, patients have the opportunity to learn about the selection of healthy foods, menus, and healthy ways of preparing food. Since stress is a major factor in the occurrence of acute coronary syndrome, the patient may also attend stress, anxiety, and depression prevention training held by a clinical psychologist. The program helps the patient to learn about relaxation techniques and become motivated for further rehabilitation and to lead a healthier lifestyle. At the end of the rehabilitation program, the patient undergoes a final medical examination with the doctor, who performs another ergometric evaluation to increase the patient's physical strength and assess how successful the rehabilitation has been. After the rehabilitation process is completed, the patient is ready to return to their daily routine. Finally, they are given guidelines to help them continue the rehabilitation process at home. If necessary, they may ask their family doctor for advice.